Hello, friends. We are together with the new topic, and we are starting a new system, hematological system. And the first topic, that is the anemia. The term anemia is defined in the Greek word just like lack of the blood, and this is identified in from the ancient world. In our Hinduism, the term anemia is defined as a pandu. If you read the literature Mahabharata, so the king Pandu is suffering from the anemia, right? So, my friend, anemia is a condition which is characterized by a decrease into the quality and the quantity of the red blood cell or the amount of the hemoglobin, which leading to the reduced the oxygen carrying capacity of the hemoglobin, and which result the different condition and the different cause, right? So let's see the what are the objectives of the today's session, right? So after the end of the session, you must know what is the definition of the anemia, what is the applied anatomy of the RBC, what is the physiology of the RBC and the oxygen transportation, which are the different classification of the anemia, what will be a clinical presentation of the patient, how can we approach a case of the anemia, which are the investigation to useful to diagnose the anemia, which are the different criteria of the diagnostic evaluation, and what will be a management of the anemia, allied as well as the homeopathy, right? So let's see what is the definition of the anemia. So anemia may define as a state in which the blood hemoglobin level is below the normal range for the patient's age and the sex. So the WHO defined the normal value of the HB into the male 12 gram per DL and into the female less than the 10 gram per DL, right? So now let's see applied anatomy of the RBC. What is the structure of the RBC? You already learned into the first BHMS, but let's some recall, right? So first RBC are the biconcave disc that lack of the nucleus in their mature form. There is a no nuclear into the RBC. ये सेल है इसके अंदर न्यूक्लियर नहीं है. Biconcave अपने शर्ट के बटन के जैसा है. And there are the primarily composed of the HB कि उसके ऊपर HP रहेगा which binds the oxygen into the lungs and release into the tissue, right? And the shape of the RBC maximize surface area for the gas exchange, and that allows the flexibility to the navigate through the capillaries. Sides में जो है वहाँ पे HB set रहता है, right? And the average lifespan of the RBC is about 120 days. This is the normal thing, and you already learned into the first PHMS, right? But just you have to recall the condition. Now let's see what are the applied anatomy of the RBC. Bone marrow. So you all know the erythropoiesis. So with the help of the erythropoietin, erythropoiesis occurs into the bone marrow. Bone marrow is situated into the bones, long bones, and into the that is the spongy bones, which contain the red marrow. So erythropoiesis occurs from the stem cell, erythropoietic stem cell, and from that there are some lymphoid cells and some erythroid cells are there, right? And from that some first erythroblast is there, then it is converted into the erythrocyte. You all know, just recall from your first BHMS erythropoiesis, but I would like to add some things. Remember one thing, when the site is behind the name erythrocyte, it consider that is the mature cell, and if that is a blast, it considered that is the immature cell, right? So erythroblast, that is the immature form of the RBC, and erythrocytes, they are the mature form of the RBC, right? Now let's see applied anatomy of the RBC, fate of the RBC, what happened after its function is over. So spleen and liver. So at the end of the life of the RBC, at the level of the spleen, the RBC will be breakdown, and hemoglobin will be breakdown, and we see heme and the globin, we learn jaundice, right? So this is the applied anatomy of the RBC. Right, now let's see what are the physiology. So main physiology of the RBC, that is the it facilitate the hemoglobin for the carrying the oxygen from the lungs to the tissue, right? So hemoglobin, that is a tetrameric protein which compose of the 4 globin chain, and with each chain binding the heme group that contain an iron atom, and that iron atom contained with the oxygen. So HB's main function to carries the oxygen from the lungs to the tissue, and they return the carbon dioxide back to the lungs exhalation. So in the respiratory system, in the physiology, you learn already how can the exchange of the gases is happen, and how the transportation of the respiratory gases are the happen, right? So the commonest condition, that is the oxygen binds to the HB and form the oxyhemoglobin. So as the blood passes through the tissue with the low oxygen, oxygen is released from the hemoglobin and allowing the cellular respiration. You already learned, just you have to recall that, right? So physiology of the RBC and the oxygen transport. So regulation of the RBC production, again physiology production. So erythropoiesis is primarily regulated by the erythropoietin, that is the hormone which is produced by the kidney when there is a hypoxia occur. So when hypoxia, kidney release the erythropoietin. Erythropoietin can responsible for the erythropoiesis. So erythropoietin stimulates the bone marrow to increase the RBC production, and the other factors like iron, vitamin B12, and the folate, they are play the crucial role and the maturation and the proper functioning of the RBC. So with the help of the erythropoietin, erythropoiesis occurs, and elemental iron, vitamin B12, and the folate, which can play a crucial role to mature the RBC and the proper function of the RBC, right? So these are the simple things regarding to the RBC's anatomy and the RBC's physiology, right? Now let's see our main topic, that is the anemia, and what is the classification of the anemia. So friends, classification of the anemia is based on the this three portion. So first, etiology. What may be etiology of the anemia? So classification, etiological classification is there, morphological classification is there, and the pathophysiological classification. So three-way, there are the different three condition and the three classification we have. So let's see the first classification, etiological classification. So first etiology, that is the blood loss. So acute or the chronic bleeding, which so due to acute or the chronic bleeding, there will be a blood loss and loss of the RBC and the HB from the blood, which is responsible for the anemia. Second, decreased production, the diseases of the bone marrow, so bone marrow failure or the nutritional deficiency like elemental iron, vitamin B12 or the folate. So RBC or the HB cannot be a proper creating, right? Or the some chronic disease like a renal failure or the cancer. In the renal failure, there will be a loss of the erythropoietin. So without erythropoietin, erythropoiesis is not happen, and the deficiency will be occur, right? Another are the increased destruction, hemolysis. तीन चीजें हैं, either blood loss हो गया है, either और प्रोडक्शन कम हो रहा है और डिस्ट्रक्शन ज्यादा हो रहा है, hemolysis हो रहा है. So hemolytic anemia due to some genetic disorder like a sickle cell anemia, some autoimmune disease, some infection or the toxins which are responsible for the hemolysis. So now the deficiency occurs into the body and the anemia is a developed. So this is the etiological classification. So I hope you can easily understand what will be a etiological classification of the anemia. Now let's see what are the morphological classification of the anemia. So morphology किस चीज की, RBC की. So you can see into the picture there are the different morphology you may show. So microcytic means the RBC are the smalls into the iron deficiency anemia. The RBCs will be small. Right, normocytic, the size of the RBC will be a normal. So anemia of the chronic disease and the acute blood loss, वो RBC के size normal रहेगी, but RBC कम है due to the blood loss or some chronic disease, right? Other are the macrocytic, the RBC size will be a large. So large RBCs like into the vitamin B12 deficiency or the folate deficiency. So these are the morphological classification. So there are the other condition, the color. So normocytic, hypochromic or the hyperchromic are also classified. We can, but easily classification is a microcytic, macrocytic and the normocytic. Now let's see the pathophysiological classification. So hypoproliferative causes or the pathophysiology, so decrease the RBC production like into the aplastic anemia or the bone marrow failure. Some maturation defect, so blast cannot convert into the site. So RBC do not mature properly into the megaloblastic anemia. And third one, that are the hemolytic anemia, so premature destruction of the RBC. So hereditary is the spherocytosis. So RBC का proper shape नहीं रहेगा और body autoimmune तरीके से destruct कर देगी premature. So this is the pathophysiological classification of the anemia. So my friend, I hope you can easily understand the three type of the classification: etiological classification of the anemia, morphological classification of the anemia, and the pathophysiological classification of the anemia. Now let's see what are the clinical presentation of the anemia. So due to the reduced oxygen delivery to the tissue, because there is a low level of the HB is not responsible to proper oxygenation, right? So there will be a fatigue and the weakness we have to found in the other patient. There will be a paleness, particularly the visible into the conjunctiva, palm and the nail beds because of the low RBC. The redness is there, so pallor is a common condition. Shortness of the breath, there will be dyspnea, especially on the exertion because of the again oxygen नहीं पहुंच पाएगा because RBC नहीं है. Tachycardia, the heart is a compensate for the reduced oxygen level by increasing the heart rate. ब्लड के अंदर कमी है और वो ब्लड की कमी की वजह से एचबी की कमी की वजह से ऑक्सीजन बॉडी में कम पहुंच रहा है. सो कॉम्पनसेट करना पड़ेगा वो डेफिशिएंसी को, इसलिए हार्ट रेट बढ़ जाएगा, टेकिकार्डिया दिखाई देगा, राइट. सो my friends, symptoms are the depend on the severity and the underlying cause, but common features are this: fatigue, paleness, shortness of the breath, tachycardia. Other are like dizziness of the syncope, right? Because in the very progressive anemia, there will be a decreased blood flow to the brain, which can be responsible for the syncope or the dizziness. There will be a headache due to the hypoxia, right? So in severe anemia, the more advanced signs include the angina, chest pain is there, angina is there, and the cardiac failure we may also found. So these are the different clinical presentation of the anemia. We have to found common condition. So it is depending on the what is the level of the RBC or the HB, and what is the severity of the symptom, right? So let's see how can we approach a case of the anemia first, that is the history taking. So we have to ask about the chief complaint like a fatigue, shortness of the breath, chest pain, palpitation, dizziness, or the syncope, right? And after that, we have to ask about the onset and the duration. So how long the symptoms have been present, acute onset or the suggest the bleeding, while the chronic symptoms point to the nutritional deficiency or the chronic disease, right? We have to assess the dietary history also for the deficiency into the iron, B12, and the folate, right? We have to ask about the menstrual history also regarding to the menorrhagia, heavy menstrual period, which can causes the iron deficiency, right? Apart from this fourth thing, we have to ask about the medical history also, like chronic kidney disease, hypothyroidism, or autoimmune disease, which can lead to the anemia. We have to ask the family history also, inquire about the genetic disorders like a sickle cell disease or the thalassemia, and the medication use. So some medication like NSAID or the anticoagulants, which is responsible to develop the anemia and which is responsible to cause the bleeding and interfere with the RBC production, right? So these are the history taking. We have to cover the all points for the rule out of what may be a cause of the anemia. Now let's see how can we approach a patient for a physical examination. So first, in general examination, check for the sign of the pallor. We have to check the signs of the pallor. We have to check the conjunctiva. We have to check the palm, right? We have to check for the taking the pulse for the tachycardia and the blood pressure for the rule out the hypotension. Then we do the cardiovascular examination. So we have to listen for the murmur which indicate the increased cardiac output. We have to check the respiratory system for the signs of the shortness or the tachypnea, right? Then examination of the abdomen. So we have to palpate for the hepatomegaly or the splenomegaly, so which may indicate the hemolysis or the bone marrow infiltration. And the neurological system for assess the symptom of the B12 deficiency, such as the numbness, tingling, or the ataxia. Right. So these are the physical examination for the uh, anemia. Right. Now let's see what are the investigations which are useful to diagnose the anemia. The commonest investigation that will be a CBC, complete blood count, hemoglobin, and the hematocrit are the primary tests to assess the degree of the anemia. RBC count and the mean corpuscular volume MCV, which help to the classification for the type of the anemia like a microcytic or the macrocytic or the normocytic, right? We have to perform the reticulocyte count also. So it is elevated into the hemolytic anemia or the acute blood loss. And we have to perform the peripheral smear, so which provide the insight of the shape of the RBC, size of the RBC, appearance of the RBC, and which is the aiding into the diagnose the specific type of the anemia like a sickle cell anemia, microcytic anemia, right? Other investigation apart from this thing, we have to do the iron studies, serum iron, serum ferritin, total iron binding capacity, and the transferrin saturation are used to evaluate the iron deficiency anemia. We have to do the vitamin B12 and the folate level or also which low level suggests the megaloblastic anemia. We have to perform the reticulocyte hemoglobin content CHR, which is used assessing the body's response to the anemia, especially into the iron deficiency. And may conduct a bone marrow biopsy in the case where the bone marrow failure are the suspected like into the aplastic anemia or the leukemia. We have to do the erythropoietin level also, so EPO. So it is a low into the cases of the renal failure and the hereditary anemia, right? Now let's see which are the different additional investigations. So first HB electrophoresis to rule out the different hemoglobinopathy like into the sickle cell disease or the thalassemia. We have to do the direct Kumb test to investigate the autoimmune hemolytic anemia, and stool occult blood test to check for the GI bleeding as a cause of the anemia, and abdominal USG or the CT scan to assess for the splenomegaly or the liver disease in the case of the hemolysis. So these are the additional investigations which we have to perform for the diagnose the anemia. Now let's see what are the different management of the anemia. So first, iron deficiency anemia. So we have to just give the iron supplement, ferrous sulfate or the ferrous fumarate, and just dietary modification. Just you have to advise the patient to take the green leafy vegetable and just jaggery and black gram nuts. चना कही शक्य हम बोल सकते हैं चना खाओ गुड़ खाओ पालक खाइए beet root is the best for that. So dietary modification in the iron supplement. We have to give the vitamin B12 injection or the oral folic acid for the correct the deficiency of the B12 and the folic acid. If there is a hemolytic anemia, treat the underlying cause. If there is an autoimmune disease, we have to give the immunosuppressive therapy, blood transfusion, and in severe cases, there will be a bone marrow transplantation. That is the choice. Another management in case of the aplastic anemia, we have to perform the bone marrow stimulant or immunosuppressive therapy or the bone marrow transplantation. And for the severe anemia or when the other treatment are the ineffective, there will be a blood transfusion. That is the good choice in the treatment of the anemia. So these are the management of the anemia. Now let's see the homeopathic therapeutics regarding to the anemia. So first medicine, that is the ferrum mat. Indication of the ferrum mat, that is the patient have a pale face with the flushed cheek, feels weak and tired, and worse on the slightest exertion. So the modality of the ferrum mat, that is the better lying down and the worse at the night and the during menses. And the characteristic of the ferrum mat, that is the alternate flushing and the pallor, headache, throbbing into the head. Second medicine, that is the China officinalis, that is the cinchona. The indication of the medicine, that is the anemia from the chronic blood loss, like a bleeding piles, pardon for the spelling mistake, menorrhagia, and the post illness. The symptoms we have to found into the China, that is the debility, dizziness, ringing into the ears, coldness of the skin. And the characteristic of the cinchona, that will be a great weakness with the no apparent cause and the sensitive to the touch. Other homeopathic medicine like Calcarea phosphorica. So in Calcarea indicate the anemia into the children and the adolescents, especially during the growth spurt. The symptoms may be a bone pain, craving for a smoke, meat, and the indigestible things, which is called as a pica. Pica means खाने को मन हो रहा है पर वो खाने की चीज नहीं है, जैसे मिट्टी खाएगा, काट वो रस्ट खाएगा, या कोई कलर खाएगा, वो स्लेट का जो चौक आता है वो चौक खाएगा. So irresistible desire to eat the indigestible things. Characteristic of the Calcarea phos, there will be a patient is a thin, emaciated children with the weak digestion. Another medicine, that is the natrum mur. In the natrum mur, the indication is anemia after the grief, loss of the fluid, or the chronic disease. The symptoms are the headache with the hammering sensation, palpitation, irritability is there. And the characteristic, that is the patient is a crave shoals and emotional is a patient. Right? Other medicine, that is the pulsatilla. The indication of the pulsatilla, there will be anemia into the younger girls, especially after the puberty or due to the irregular menses. And the symptoms are the sad, weepy, chilly, needs open air girl are there. Characteristic is a changeable symptom, desire to the consolation. Another, that is the sepia. Indication of the sepia, anemia in the woman with the uterine trouble. There will be a chronic menses or the hormonal imbalances. Symptom of the sepia covers the weakness, irritability, bearing down sensation. And the characteristic of the sepia, that is the indifferent to the loved one and the desire solitude. Other homeopathic medicine, the first one, that is the arsenicum album. So arsenicum album, anemia with the great restlessness, anxiety and the prostration. And the symptoms are the pale, waxy skin, burning pain, and the thirst for the small sip. And the characteristic are the worse at the midnight and the chilly and the fearful. Other drug, that is the phosphorus. The indication of the phosphorus, there is bright and the intelligent patient who tired easily. Symptom is a bleeding tendency, vertigo, and vertigo is there. Characteristic is a patient is a tall, thin, delicate person, and the affectionate disposition we have to found into the patient. Other homeopathic therapeutics are lycopodium, which indicate anemia with the digestive disturbances like a bloating, flatulence, symptoms like a craving, fevers, sweets, warm drink, irritable and bossy. Characteristic symptoms is a worsen from 4 to 8 p.m. Right? Acetic acid indication is a profound anemia from the chronic diarrhea or the bleeding. Symptoms are the mark pallor, edema, weakness, and the crest thrust. And the characteristic of the acetic acid, that is the pale waxy face, and the patient is emaciated. Right? So these are the different homeopathic therapeutics we have to found. Let's see one table. On that table, we can easily select the remedy which may be a cause of the anemia. So if there is a cause of the blood loss, trauma, menses or the piles, we can choose the China, ferrum mat, hemamelis and the millefolium. If there is a nutritional deficiency like iron and the B12, we can choose from the ferrum phos, natrum mure, calcarea phos, acid phos. If there is a cause, maybe a chronic illness, we can choose the China, arsenicum album, phosphorus, acid, tuberculinum. If there is a worm infestation into the children, we can use the Sina and the Centonium and the Tucrium. If there is a grief related to the anemia, we can indicate the Natrum mu, Ignatia. If there will be menstrual irregularities, we can use the Pulsatilla, Sepia, Ferrum Met. So these are the easily selection of the remedy, easy table for the selection of the remedy. Now let's see which are the different homeopathic biochemic remedies for the anemia. So first ferrum phos 6x. So this is the first stage of the anemia. There will be inflammation and the low grade fever. We can give the ferrum phos 6x. Calcarea phos 6x for the anemia into the children after illness, and the natrum mure 6x for the weakness, headache and the salt craving. So these are the different biochemic medicine for the treatment of the anemia. Right. So I hope you already understand your all objectives. What is the definition of the anemia? What is the classification of the anemia? Which are the clinical presentation of the anemia? What are the diagnostic evaluation criteria to diagnose the anemia? And what are the management of the anemia, allied and as well as the homeopathic therapeutic? Right? So friend, thank you very much for the listening me, and I hope you can easily understand. And if you have any found any query or you can't understand the session, you can ask me as a comment or you can message me as all you know. So once again, thank you very much. Stay safe.